Hello, good evening and welcome to a special broadcast of Nationwide at 6 that we are bringing to you from the national capital. I am at the Lodhi Road here and I just want to tell our viewers why I'm standing here. Because usually for many years you would come to this office, to this building, the Prithvi Vigyan Mantralaya, the Earth Sciences Ministry that you would be seeing on your screens right now. Just behind it, this board, this LED screen that you are seeing always used to have the data of air pollution. How much is the air pollution in the city of Delhi and at various places, because this is one of the air pollution monitoring center as well. It always used to display the data here. Now, while the pollution is going up, somebody, whether in the government or in this department, has decided that people don't need to know exactly what the pollution levels are. So it is very surprising that this entire LED screen at this moment is blank, ladies and gentlemen, which used to be buzzing with data of all the places in the national capital where you would see the pollution levels. But let me very quickly, before I begin, and why I am talking about pollution here, wearing this mask, because, and trust me, if you are outside, you should also wear a mask. The condition of the pollution in the city at this moment will demand that. The data on my watch shows that at this moment in the national capital, the pollution levels are at 339 on the AQI. So on the AQI, Delhi at this moment is in the severe category of pollution. And this has been a hue and cry as far as the citizens are concerned. When it comes to pollution, when it comes to, in fact, the government or the agencies not acting as much or not finding the solutions that are needed to combat pollution. Now, what I want to tell you at this moment, where I'm standing at this junction here, is that while we are failing in the fight of pollution, the government of India comes out and says that two important things, ladies and gentlemen. A, the government says that there is no credible data to tell you anything about pollution-related deaths. They have denied that there is, at this moment, science doesn't tell you how many people have died because of pollution. And apart from that, the government has said that in absence of some credible agencies collating the pollution level markers, like the WHO would say 50 is good air quality, the government has said that we will make our own pollution indices, suiting to what India, in Indian context, is. So it seems at this moment that the whole attempt is that A, when the hue and cry and people are talking about pollution, the government wants to tell you that there are not credible data to suggest the number of deaths, and also the pollution level indexes, the indices that we are talking about, that need to be relooked and in fact tweaked for Indian standards. Now I want to tell you that in a written reply in the Rajya Sabha, Minister of State for Environment Kirti Vardhan Singh stated that widely quoted international indices. Stephen, just go a step back. Stephen, just go a step back. Thank you. Widely stated, the pollution indices reports, whether it's the WHO Global Air Quality Database, Environmental Performance Index Database, and the Global Burden of Disease Matrix, are not conducted by any official agency. So WHO, as per the government of India, is not a credible official agency to go by their data. The minister further clarified that it has been noted that national ambient air quality standards for 12 pollutants in 2009 to protect public health and environment, these standards are tailored for India-specific conditions. So basically what they are trying to tell you, that the international standards, that is not what the government wants to go by. We cannot match up to the international standards. So what we'll try and do, we'll make our own standards and decide what is harmful for the number of pollutants which are harmful for you, whether it's PM 2.5, PM 10 or any particle levels. Now, I want to put out some very important information and graphics for you. Number one, ladies and gentlemen, while the government says, and let's just take this graphic full frame, the government says that there is no data of deaths due to pollution. We cannot quantify the number of people dying because of pollution. That is what the government's argument is. But I want to just tell you, Lancet, worldwide acknowledged science journal, has in fact come out with a study which says 15 lakh deaths in India are due to pollution. The global burden of disease, toxic air leading cause of death in Delhi. The University of Chicago study also said that pollution is shortening the lives of people in Delhi by 10 years. You are losing a decade of your life because of pollution. That's what the University of Chicago said. Meanwhile, the Harvard study said 1/3 of pollution-related deaths, 1/3 of deaths in India every year are linked to pollution. I'm sorry, pardon me, because I'm coughing a bit. I'm standing at a traffic junction, so of course the pollution level here are incredibly high than even normal places. But so there are credible studies which link deaths, because of pollution in the country, which the government says are not credible enough. So hence there is no data to suggest that. Now, I also want to very quickly, ladies and gentlemen, tell you what the government is saying about setting their own standards as far as the AQI levels are concerned. And mind you, the 2009 AQI levels, the standards which were set, are already 8 times higher than the global WHO recommended standards. So already the pollution levels or the standards that you have are 8 times higher. So what the government is trying to do, it says India sets its own air pollution norms. The air quality ranking by various official organizations, whether it's the WHO or the others, they are saying that they carry no official sanction. So the WHO air quality guidelines are just an advisory in nature. WHO guidelines are not mandatory standards of India. So if WHO says that 50 is the good air quality, that's what we require, the government says, well, don't go by it. That's not something that you need to be bothered about. The air quality standards, I just want to tell you, for the WHO, PM 2.5 level there should be, in fact, when you look at the data, should be 5, and India has set the limit 8 times higher. PM 10 also is 15. India has set the limit at 60, which is 10 times higher. India limit is 4 times higher when it comes to PM 10 and 8 times higher when it comes to PM 2.5. If you talk about nitrogen dioxide, NO2, which is, of course, one of the major, in fact, gases that is released by vehicles, the WHO standards are 10, while India standards are 40. That is 4 times higher as far as the pollution levels, globally acceptable levels, are concerned. I want to at this moment go across to one of the leading pulmonologists and one of the known faces in India's medicine field, Dr. Randeep Guleria, who is joining me at this moment, needs no introduction. Dr. Guleria, thank you so much, sir. Really appreciate the time that you are giving our channel at this moment. Sir, I want to specifically speak to you and ask you, it's a reply that the government has given in the Rajya Sabha where 2 important things have been said. Number one, that there is no official sanctified data related to deaths as far as pollution is concerned. And they have also said that don't go by WHO standards. They are just mere guidelines. India has its own standards which already are 8 times higher than what the WHO says. Is there any link, sir, to people dying and pollution?
I think there's enough data not only from global research, but from India also, that air pollution is an indirect cause of a large number of deaths. It's a silent killer, and we're having an epidemic of deaths because of the indoor and outdoor air pollution. It's like saying that smoking doesn't cause cancer. You have no data to say that this person had any test to say that this person who smoked got cancer. But there is enough evidence which shows epidemiological evidence and lab-based evidence which shows that that the cancer is related to smoking. Similarly, there is data which is from India. There is data from the global burden of disease. There is the global state of air data. All of it shows that not only in India but across the world in areas where pollution is high, there has been increasing number of deaths. And unfortunately, India sort of leads this in terms of outdoor air pollution. We are seeing a huge number of deaths. The global data suggested that last year 8 million people died because of air pollution, and most of these deaths occur in the developing or the emerging markets because of the rapid industrialization and unchecked pollution control measures. The quality of air is very, very bad. There is also data from various institutes, including AIMS, which clearly shows that when the air quality deteriorates in the next 4 to 6 days, there is an increase or a huge surge in emergency visits by people with respiratory problem, and this is occurring in adults and children, and many of them get admitted in the ICU or land up on a ventilator, and because of that, it leads to their death. So I think you have enough evidence to show that. There is also a Lancet study which looked at the 10 city data from India last year, and this also showed that for every 10 microgram per meters cube rise in PM 2.5, the mortality goes up by 1.4%. So there is enough data to suggest that it is linked to poor quality of life, more respiratory problems, more systemic disease, and higher mortality.
Sir, does that mean what you are saying, sir? Studies you said conducted even in India, and then of course Lancet and others which have also gone in details. Does that mean that we are living in denial? We cannot solve this problem. So the only logical solution is to say, let's go by Indian standards. Let's not think about the WHO standards, the debate which is going on since 2009. And number two, then to suggest that people are not dying from pollution, so why take it so seriously?
So firstly, WHO itself recognizes the fact that air pollution is a leading killer. And as a matter of fact, in 2021, WHO lowered the standards of acceptable quality of PM 2.5, PM 10, because it realized that there was enough data to suggest that even the values that they had suggested in 2001 were not acceptable in terms of good quality air. Having said that, it's important that each country develops its own strategy and tries and sees what are the achievable levels that they can have to begin with. We should aim to have WHO levels. If you look at data from, let's say, many cities in Europe or UK or even in the US, the the AQI is usually between 10 to 20. They also have very good quality air. If they can do it, and if China could do it, I'm sure India can do it. We must accept that it is a problem and then work towards finding a sustainable and practical solution.
Sir, I want to very quickly put on air a study, in fact, which was conducted at the Gangaram Hospital, their pulmonology department. And this is a very shocking study, and I would want you to comment, in fact, on that as well. The study, in fact, suggested that whether you are a smoker or not, lung cancer is being caused in people, those who don't even smoke. In fact, doctors have said that in Delhi, toxic air is driving new cases. In 1988, 90% of the lung cancer patients were smokers. Now, 50 to 70% lung cancer patients are non-smokers. Specifically talking about the young people in Delhi, they are in their 20s, they are getting lung cancer, and breathing in air, in Delhi's air, is almost like smoking 25 cigarettes a day. The PM 2.5 particles, they penetrate deep into the lungs and they trigger mutations leading to cancer. This is a very alarming study, sir, because for most of the people, lung cancer was something which they would have thought, if you are smoking cigarettes, possibly that would be one reason. Now there are young people in their 20s and 50 to 70% cases admitted, even in Gangaram Hospital, suggest that there are lung cancer patients, those who have never smoked a single cigarette in their life.
Yes, so if you look at data from India, you will find that gradually now we are seeing more non-smoking lung cancers than smoking lung cancers. And one of the factors for this is related to exposure both to indoor and outdoor air pollution. As a matter of fact, many years ago, studies done from PGI Chandigarh also showed that there was a higher chance of women developing lung cancer even when they were non-smokers, but you were exposed to a lot of indoor air pollution. And now there is data for outdoor air pollution also that this is linked to lung cancer. I think the other important thing to remember is that the mutations that occur is not only in the lung itself. PM 2.5 and ultrafine particulate matter, which we see, have various toxic particles which are known as toxic hitchhikers. They attach to the PM 2.5. They go not only to the lung, causing mutation, they can travel to different parts of the body. And there is data which is emerging globally that air living for many years and getting exposed to poor quality air may itself be one cause of developing many cancers as we are seeing in the developing world.
So 2 cam mein he will take shots so that they can cut. Let me also, before I let you go, sir, let me also ask you this. In your experience, like you said, is it lack of political will, or is it just an acceptance that we cannot in fact fight this battle in an effective manner? That's why, and I'm standing at a place which used to in fact always show the pollution levels in the national capital, that board has been switched off. Do you feel that much more needs to be done in this fight, rather than of course trying to change standards or give in fact these twists that data is not credible, sir?
Yes, first of all, I think for any action that we need to take, we must have credible data. Data is something that will help us and guide us as to what we can do. Data to tell us that what is the level that we are being exposed to, what are the emissions where are the emissions coming from, what is the type of particulate matter, and what is the other noxious substances that we are seeing in the air, and then what are the measures that we can take which are practical, sustainable, and can be done for our own country. So I think first issue is to accept that there is a problem. I think it's pretty visible. Anyone who goes to the Indo-Gangetic belt travels doesn't need to carry or see the AQI. He can feel the fact that the air that he's breathing is not of good quality. There are a lot of respiratory symptoms that develop, and if you continue to breathe such bad air, you are going to have long-term problems, especially children and the elderly. So I think it's important for us first to accept that there is a problem. We need to have data, and then we need to work as together. Policymakers, scientists, common man, everyone needs to come together to see what we can do to really find a strategy to really decrease or improve the quality of air and decrease the poor air that we're seeing not only in Delhi but in the Indo-Gangetic plain.
Absolutely. Thank you so much, Dr. Guleria, for your time, sir. Very, very important what you have said. There is going to be, in fact, nothing that is going to come out by denying data or trying to say that this data is not credible. It's upon all the policymakers, all of us, to come together and ensure that there is a better quality of life that we can not only provide to ourselves, but to, in fact, future generations as well. The entire northern India, most cities across the country are suffering from this problem, and changing standards, challenging the data is not going to be the solution. Thankfully, in the current context and of course the politics which is around it, we saw today Rahul Gandhi in fact picking up this issue in the parliament. And he in fact spoke about this, also said that the opposition parties are united as far as this issue is concerned.
This is an interesting issue because I'm certain that there will be full agreement between the government and us on this issue. This is not a, this is not a ideological issue. This is, everybody in this house would agree that air pollution, the damage it is doing to our people, is something that we would like to cooperate on. I think it's important that the government develops a plan for how to get rid of air pollution in our cities. We are more than happy to cooperate with the government on developing such a plan. There are not many issues these days that the government and the opposition, entire opposition, can agree on.
Leader of the opposition, Rahul Gandhi ji, has made a statement in the form of suggestion. The member of the Congress party in the Business Advisory Committee had also raised this issue and some other parties, and from the government side also. And government from the day one had made our position very clear that on all important matters, government is ready to discuss and also to find out solution, taking along the suggestions from all the members, including the principal opposition party. Government is always prepared to have discussion under any rule, but only what the point I want to make is, since the matter was brought in the BAC, we will come back and let us see how we can structure the discussion into, and then we are ready to take up this matter.
Meanwhile, while the questions are being raised on the pollution data as far as the national capital is concerned, one clip of an interview which happened at the Hindustan Times Leadership Summit, the interview of the Chief Minister of Delhi, which was conducted by my colleague Padmaja Joshi, the Chief Minister of Delhi was heard saying that AQI is like a temperature. Now, this has become a viral sensation, with people, in fact, ridiculing the Chief Minister for her lack of knowledge as far as the basic parameter of, air pollution is concerned. Take a look.
आप मुझे बताइए हॉटस्पॉट क्या होता है? हॉटस्पॉट वो होता है कि जहाँ सबसे ज़्यादा पॉल्यूशन होता है, ठीक है? सॉल्यूशन क्या है? आप वहाँ पे स्प्रे करते हैं, वाटरिंग करते हैं, आप मिट्टी को बिठाने का काम करते हैं, तो स्प्रे हॉटस्पॉट पे ही तो करेंगे आप। कोई मॉनिटर पे करके AQI डाउन होता है क्या? और AQI एक ऐसा आपका टेम्परेचर है, आपको जो किसी भी इंस्ट्रूमेंट से पता चलता है, तो उसमें वाटरिंग इज द ओनली सॉल्यूशन, जो हम भी कर रहे हैं, जो पिछली सरकारें भी करती थी, और वो हॉटस्पॉट पे ही होता है। जहां सबसे ज्यादा पॉल्यूशन होगा वहीं तो आप सफाई करेंगे।
All right. There is, of course, as I said, eventually it will be a political debate because politicians, the policymakers, will have to decide what needs to be done as far as air pollution is concerned. Let me very quickly introduce my guests, those who are joining me from here in the national capital. Dr. Anil Gupta. He's the board member of the Central Pollution Control Board and also the Delhi Pollution Control DPCC as well. He's also the spokesperson of Delhi BJP. I'm also being joined by Dr. Nishant Anand of the Congress Party. Somnath Bharti, former minister and spokesperson of the Aam Aadmi Party, is on his way. I just want to show you, we are stuck. The Prime Minister's route was here, and that's why all roads leading to where I'm standing have completely been blocked. The Prime Minister would be, in fact, crossing this area very, very soon. We are hoping that the Prime Minister would lead the initiative to fight this entire fight against pollution or make this situation better. But Dr. Saab, tell me one thing. गवर्नमेंट बोल रही है कि जो डेटा, इंटरनेशनल डेटा जो है, बोल रहे हैं कि कोई भी डेथ्स जो है पोल्यूशन से रिलेटेड नहीं है, उसका कोई साइंटिफाइड डेटा नहीं है। WHO के स्टैंडर्ड्स का कोई मतलब नहीं है, वो सिर्फ गाइडलाइंस हैं। हमारे अपने स्टैंडर्ड जो 8 टाइम्स हाई हैं WHO से, क्या प्रॉब्लम को नकारने से सिचुएशन बेहतर हो जाएगी?
See, India has national ambient air quality standards. There are 8 parameters involved in that, which are regularly studied. Out of these 12 parameters, 8 are included in air quality index. They are PM 2.5, PM 10, NOx, ozone, all these things. And World Health Organizations, they issue the advisory. They have mostly 5 parameters of particulate matter, 2.5, 10, ozone and NOx, all these things. And if you compare the WHO parameters, the parameters which we have in AQI are more stringent, are more as compared to WHO. And these are
how? I'll tell you why. I'll tell you how. PM 2.5, PM 10 और NOC जो NOx gases है, उसी के बारे में बात कर लेते हैं. All our standards are at least 4 to 8 times higher than what WHO prescribes or suggests. So is it to say that if we can't meet the global standards, let's raise our standards so that people can't even question that?
See, India is a vast country. We have a population of 140 crores. when the standards were formed, it was not today. It was not during the Modi ji government. It is an old one.
2009.
2009, I'm telling, when the Congress was ruling this country. And if there is a discussion of revision, it is always welcome, as mentioned in the parliament. But still, if you compare the AQI of India with the developing countries, it is still better.
It's better. Sir, आपके पास ऐप है pollution का?
I have the mobile phone which can show the reading in the app.
Can I see it from your phone? What is the reading where we are standing at this moment?
Roughly, it is today average as per the CP is 349.
349. Under which standard, whether it is WHO or Indian guidelines, are we saying that this is acceptable standards of pollution for any human being?
No, it is not good standard, I'm telling you. But if you talk about all the cities of the country, under the National Clean Air Programs, we have many cities like Indore, Ahmedabad, Surat, which are meeting the AQI of less than 100. But if you compare the other cities with the Delhi NCR has a problem. We are not.
Who will solve that problem? You are. Hold on. You have a government of BJP at the center. You have the government of BJP here in the national capital. You have government of the BJP in neighboring state of Uttar Pradesh. You have the government of BJP in Haryana. All the neighboring states. Rajasthan, you have government of Bharatiya Janata Party. Why is it? What is it taking so long for the government, maybe the environment minister, to call all the chief ministers and try and formulate a plan? What are we waiting for?
Give me some time to reply. It is not a one-day solution problem. Delhi, we have a government after 27 years. We inherited a lot of things in legacy. If you ask me to data, we have a legacy of 152,000 metric tons of this garbage. We have thousands of tons of dust lying on the roads. We are cleaning. But if you compare the AQI of 2025 November, December month with the 2024, 2023, it is still 550 points better than the last year.
No, it will be because wherever the monitors are, you have been portraying water. We have seen that how the water has been thrown. यहाँ पर एक monitor लगा हुआ है sir. उसका monitor क्यों बंद करा हुआ है? Why can't people know what is the AQI here at Lodi Road?
Delhi has the highest number of monitoring stations in the country.
All of them are being watered by the government so that the pollution levels can come down.
Either you listen to me or put...
I will only ask questions what people are asking.
Let me reply also,
Sure.
Delhi has 40 monitoring stations. Each parameter has different equipment and apparatus to measures. They are indoors. Just if you pour water on those instruments, they will be destroyed. It is not possible to put water on the instruments to take the readings. Only on the hot spots. Delhi has many hotspots where the AQI is high. The sprinkling of water is the suppressing of this. That is done.
So if you do the sprinkling around the monitors, not on the monitors, won't it suppress?
You cannot sprinkle water on the monitor.
I did not say that. Around the monitors. In
So it is in the hotspot.
So hold on. You are saying in hotspots if you sprinkle water.
It is not only
hold on.
It is all over the country.
Can I speak?
All over the city.
Can I speak? If in hotspots you sprinkle water, that helps in bringing down the pollution,
that
right?
helps in the dust mitigation.
And that helps in bringing down the pollution level. PM 2.5 and PM 10 level.
Dust mitigation, yes.
Good.
Yes.
So if you start doing that exactly around the hotspots, won't the readings show much lower than anywhere else?
No. See, it is being done all over the city. We have mist spray. Now we have installed in IT on several places. We have the water sprinkling tankers all over the city just to mitigate the dust. These are being used.
And that includes switching off the monitors for few hours in Diwali. That is the allegation that has been.
No, it is not. It is not switching. It is not switching. You are using the wrong word. It is not switching.
I'm saying that's the allegation from the government of Delhi.
I'm replying, I'm replying.
Go ahead.
See, nowhere, never in the history, 15 monitors were shut down. Only the UD link, when there is a sudden spike, the UD link failures. And it is a continuous monitoring station. Okay. Have a faith on CPCB. Have a faith on DPCB. They are giving the continuous.
The pollution level doesn't allow the citizens to have any faith on the agencies which are working. But I will come. Arey sir,
the government which is for 8 months old to control this.
जो 11 साल वाली सरकार है उसे blame नहीं करें. इस पूरे pollution में. Tell me, hold on. No, you tell me. एक minute. Before that, before they have not done anything. That is why they have been voted out of power.
I'm saying we have reduced the AQI by 50 points as compared to the previous.
Tell me the last meeting the government of Delhi or you went with the environment minister of this country.
I am not a part of the government, but you read.
As the member of the GPCC of the CP.
I am as a board member. Whenever board meeting is held, I participate.
सरकार की कब हुई थी सर मीटिंग?
Sarkar to regularly they are meeting. Ministry of Environment, Government of India, day before yesterday.
I have not seen the Environment Minister
I will ask
ever.
him to invite you
Please
to
do.
the meeting.
That will be great if we can have that.
Go and speak to the Environment of Delhi. He will tell you.
Environment Minister of Delhi tells us a lot of things. Nothing happens on the AQI meter. But tell me one thing. For the Congress party, today Rahul Gandhi spoke. But does that, in fact, is the Congress party happy that हमारे नेता ने बोल दिया अब जो हमने अपना presence indicate करा दिया on the matter? The government says that Indian standards are different from the global standards. What is wrong in having our own set of standards? Why should we go with what global standards are?
Hi, good evening to everybody. See, today we can see how incompetent the BJP government is. Today in center there is a BJP government, state, LG, MCD, everywhere is the BJP government. They do not have a single step that they have taken before the air pollution time started. Point number 2, when the CM Rekha Gupta was asked, tell me something, tell us AQI, what steps you are taking. She's comparing AQI with IQ and temperature. When the question is asked another time in a rally, she's asking for chole bhature. When the same question was asked, Naib Singh Saini at Haryana, he was talking about jalebi. So these chief ministers who have been appointed, they've been performing for the people. They've been not working for the people. Point number 3, last year Supreme Court clearly said, why did the LG cut 1500 to 2000 trees in Delhi? And he answered, I'm sorry, I did not know. Point number 4.
Can I ask you one point? Today there is a lot of outrage about India kya standard of the AQI monitoring and the world standard. The standards were set in 2009.
Yeah.
All the parameters that were set in 2009 are 4 to 8 times higher than the WHO standards.
Correct.
You were in the government at that point of time.
Correct.
Why were the standards not? So you are saying that the government, the Congress, the UPA government at that point of time thought that we cannot meet the global standards. Let's give our people, standards which are 4 to 8% times higher, so that people can suffer with the pollution but cannot come and complain because we are meeting the standards.
Okay, so we need to understand today Haryana, UP, Delhi, all the places there's a BJP government. When Modi ji goes to UP, he's talk about Ganga Meri Maa hai. When they come to Delhi, they talk about Yamuna and air pollution, we will fix it. Now they need to answer why the neighboring states have the government. I live in Gurgaon, there's an AQI of 950, which was touched last year, 850, 700. Why they are not able to fix anything in Haryana or UP? Now the question here is what steps they took before last month. Now they introduced
You didn't answer about the standards which were set by the UPA government.
See the standards, Congress party tried planting of trees. We even tried stopping the cars and doing odd and even. We took measures. There was never 900,
Congress did that or Aam Aadmi Party did that?
No, we tried when the government was there. There was never 800, 900 AQ at that point of time. See, we were aggressively working towards fixing the problem. What have they done for the Kudedan from 11 years? They have been into the MCD government for many years. That's what I said. If you talk about any of the state, Haryana, 11 years, single step has been taken towards fixing the air pollution. Okay. Now, one last thing. In the last month, 11,000 children under the age of 15 got respiratory problems because of the air pollution. They are not able to answer that.
Okay. Is do you agree, sir, because you are part of the system, do you agree that air pollution is a major cause of standard of poor quality of life, lung cancer, problems, even death?
I agree that deteriorating air quality leads to respiratory problem. It is an established fact. But there is no Indian study which talks about the death.
Dr. Guleria was with us just before you started speaking. He said there are studies from AIIMS, PGI Chandigarh, also Gangaram, which now clearly suggest that air pollution is a big mitigating factor as far as mortality is concerned. People under the age of, till the age of 20, young people who have never smoked are getting lung cancer because of air pollution. Government says we don't care about this data. There is Lancet data, WHO data, Harvard University data. There are data from other places. Is the solution to pollution shutting your eyes?
See, as far as Dr. Guleria is concerned, he is part of the many committees in the government. I think if he has any studies, he should put forward to the government, and government should take a serious note on this. As far as the air pollution is concerned, I admit it is a problem. I never deny that. But you have to see the efforts. As far as Delhi is concerned, we are able to reduce as compared to the previous years, and we are working on this. I can give you hundreds of examples what we have done in this year. But it will take some more time. It will take 2-3 years.
दिल्ली ने केजरीवाल जी को भी बहुत टाइम दिया, आपको भी देगी, उसके बाद सवाल पूछेगी. लेकिन मैं एक सवाल, सर मेरा ना क्योंकि ब्रेक का टाइम हो रहा है, मैं एक सवाल आप दोनों से पूछना चाहता हूँ. पोल्यूशन सीरियस प्रॉब्लम है, आप दोनों ही मानते हैं ना? तो सर आप मास्क पहन के क्यों नहीं आए? या खतरों से खेलने का, खतरों के खिलाड़ी हैं आप?
आपके कैमरामैन ने भी मास्क नहीं पहना हुआ, आपके क्रू ने भी नहीं पहना हुआ। नहीं, जरूरी नहीं है।
हाँ, जरूरी नहीं है।
जरूरी नहीं है। अगर आपकी हेल्थ ऐसी अलाउ करती है तो बिना मास्क भी रह सकते हैं। मुझे लगता है अभी ऐसी इमरजेंसी सिचुएशन नहीं कि आपको मास्क पहनना चाहिए।
340
They were
मास्क पे नहीं मास्क पहनना चाहिए।
They were wearing masks last year from the last 4 years. Every time, if you remember, all the spokesperson was standing on the road with the NO2 mask. Now they are not wearing it when the AQI is 700, 900. Now I removed it because your crew told me to remove it for the camera. I've been wearing NO2 mask.
If my crew, sir, पिछली बारी बहुत हो रहे थे, बीजेपी स्पोक्सपर्सन मास्क लगा के, एयर मास्क लगा के घूम रहे थे। खैर,
जरूरत होती है तो पहनना चाहिए।
खैर, द फैक्ट जब जरूरत होती है।
हाँ।
300 अभी तो 340 दिखा रहा है, उस पर जरूरत नहीं लगती ना आपको?
मुझे नहीं लगता।
ठीक है।
400 से नीचे फिर भी बेटर है, बट बहुत अच्छा नहीं है। मैं कह रहा हूँ
400 से नीचे पोल्यूशन बेटर है। मास्क पहनिए मत पहनिए, ऐसा उनको लगता है कि अगर आप हेल्दी हैं, बट प्लीज लिसन टू माय एडवाइस. This is extremely harmful, dangerous. This PM 2.5 levels go deep inside your lungs and they stay there. So if you are stepping out, make sure, especially in the morning and the evening, to wear a mask. Protect yourself, protect your children, because in the Rajnetik tu mein, nobody cares about what is happening to you. That's all the time that I have on this very important issue. I'm going to come back with much more on the other side. Thank you to both of you for joining me. A quick break. We are coming back.